Good afternoon. So today is going to be a different topic. It's going to be about nursing homes and elderly care. A lot of frustration I've been having to deal with since I've been taking care of my grandfather for the past 2 or 3 weeks and having to put him into the hospital, then into a nursing home and go from there. There's a lot of tricks and a lot of things no one tells you about or you don't even know about when going into this. If you have an elder person in your family and they have Medicare and TRICARE, meaning they were in the military, there are definitely a bunch of different steps to do to keep using the government aid instead of paying out of pocket. Even if it seems like he has a stroke or someone has a stroke in your life, take them to the hospital and don't mention the word stroke if they've ever had problems swallowing. They'll do a swallow study, and that swallow study will pigeonhole you from going anywhere your entire life. Um, we tried to bring him to the hospital and then take him off NPO, which is no food by mouth, and bring him to a facility, a care facility, and now they just try to discharge him because he apparently was too scary for one of their female overdramatic nurses. Vitas has to also be some of the most incompetent people on earth. Don't ever use Vitas Hospice. And having to deal with people in the elder care, just in general, from nurses all the way to doctors, they don't care. If you're old, they just want you to die or stay there and milk your money as long as possible. Now, if someone could actually give me a real place in Florida that is not like that, I'd be surprised. Seems like everyone that I've dealt with so far doesn't care about anything except for money. How much money they can get out of you and milk you for, or milk your Medicare for if it's not the hospital. Um, so be wary and know the few things that family is important to you, family is important over everything, and money shouldn't matter. Um, there is a few tricks to do when getting them into a care facility so it's free. If you have an elder person that you know you can't take care of anymore and they have Medicare and TRICARE, hopefully they do because Medicare and TRICARE are great, then you can get them into a long-term care facility for free in Florida. I'm not sure about any other states yet, but in Florida for free by taking them to the hospital, letting them wait the 3 days, and then they can transfer to a nursing home. Now, as long as you've not let them do a swallow study and be put on NPO, Medicare will cover everything. If you take them off and put them in hospice care, Medicare will no longer care for anything and you'll have to owe it. So my family's going to end up having to pay $6,300 for him being in a care facility when it would have been completely for free if we would have just known the tricks and known to not take him in there and to not say what the hospice person said. So multiple people made a mistake here. None of it was on our family, but no one else wanted to actually help except for get money, get referral bonuses, all that kind of stuff. And it was just, it's been a very traumatizing experience for me. It's opened up my eyes to how bad healthcare is in the United States and how much reform we actually do need for our veterans. And I know Trump did an awful lot. It's probably going to be reversed this year. A lot of the positive stuff that he's been doing has been going away with the single pen stroke and not having to even go through Congress. So, and these hypochondriac fat white ladies seem to not understand either. When there's an issue, you don't have to freak out. How to think calm, cool, collected, how to actually speak to people. I think a lot of that has gone downhill, um, especially in this country. And a lot of division, a lot of people just don't know what to do. They're just scared. They're just upset. When you get these people into an elder home, you have to pay attention to the people there. I walked him into the home. Well, I didn't walk him. I left, what, Friday of last week, and he was able to use a walker, doing okay. To this morning, I get a frantic phone call saying that he needs to be discharged because of NPO, and he has to go back to the hospital, all because one nurse didn't do her job and called another doctor and just relayed to her frantic upsetness about something. So stay away from speech therapists. If someone says, we want to get your old person around a speech therapist, say no. Do not say yes to a speech therapist because they will do nothing besides be over dramatic and try to get you guys to have to spend more money for your family. So say no to speech therapy. Say no to hospice if you can get him into a home. Now, if he's already completely bedridden and, or someone is completely bedridden or anything like that, then, go the hospice route. You're going to have a little bit more of difficulties. Mine is completely bedridden. Almost. He can get up assisted. He can walk with a walker and maneuver around. Last Friday when I saw him, he was doing it, and he had conversations with me last Friday. Now today, he's bedridden. again, and he can't even speak. So when you guys pick long-term care facilities, make sure that you guys buy long-term health insurance. That's another thing that no one has told me my entire life. I've never heard anyone saying that. But as you get older, long-term health insurance is definitely something that's huge in elder care. If he would have had that, I mean, he has everything else, but if he would have had long-term care, I could have dropped him off to one of my close friends that I know that works at another nursing home, and he'd just go for like rehab, and he'd be okay. But those are just some of the things that go on inside the nursing homes and with doctors and hospitals. None of them are here in the United States for good reasons, I've noticed, and no one actually cares about your family. They just want their job to be easy. They don't want to have to deal with you as a person or anything else. I mean, I know nurses and doctors go into supposedly their profession wanting to be good people and to want to do good, but it seems like they lose that aspiration after the first year or two, and it's all about just a normal job. They don't care if your family's in there dying or happy or alive. They just care about what can I do to make my paycheck, and it doesn't matter if this family's person is dying. Let's just make the money. So if someone that you know, or if you know someone going into a hospital that's your family, try to tell them the situation is put them in the hospital first. If you guys Medicare and TRICARE especially, don't put them into hospice, or hospice will, basically make you start paying out of pocket. Um, that's if he has to go to a nursing home. Now, if he's going to be already after life thing where hospice is coming in for like the last week, they'll probably just pump him full of morphine, let him die, or her. I'm not sure. I keep saying him because it's my situation. But just do your due diligence, guys. I can ask and answer any questions pretty much now that has to do with elder care. Don't rush and get them into a facility. Don't rush and get them hospice care. Do your research on good ones. Like I said earlier, stay away from Vitas. I hated them personally. Their social worker caused so much stress and anxiety between us and my family. It wasn't even worth it. The nursing home isn't any better. Honestly, the doctors, the hospitals just wanted to hit his Medicare. So whatever you can do, stay away from doctors, hospitals, and everything as long as possible. And if you guys don't have long-term insurance, you better have a lot of money because it's not cheap. And you got to learn to work the system or the system will work you. So that's one thing we've definitely noticed with the frantic nurse calling. No real doctors actually checking on my grandpa saying that, yeah, he actually is NPO and, it is too dangerous for him to eat. They just see some silly swallow study and they're like, oh, he got a little bit of stuff in his lungs. He's going to die. No, he's not. He's okay. He's had this trachea surgery a long time ago where they expand his, throat so that he can swallow better. He's not dying. This has been an issue that we've all known about. Let me sign a waiver or something, but no, you have to have hospice because they want to double milk you for money because hospice gets their own money, they get their money from us, and stay away from it as much as possible. If someone takes you to the hospital and you know they're really, really, really old, like my grandparent is a 91, if they ask to do a swallow study and you know that they've ever had anything done with their throat or you know that they're just old in general, say no to a swallow study. Pay attention. Don't let them do whatever they want to do at the hospitals. Ask questions every step of the way. Demand answers. And don't let them do to you what they've done to me. So just do what you can. Comment, like, subscribe here, and I'll try to help out if you guys have any questions.